Good morning, first.
Good evening, Anu. Good evening, everyone. Yes, I'm audible to
Good
everyone.
evening, ma'am. Yes, ma'am.
Can I have everyone on the camera? Okay. Okay. Okay, let me do one thing. I have an option. Yes, okay, I understand. And I have an option of pausing this, that in NCLEX, there's a golden rule. If there is subjective data, okay, subjective data means
Patient
What patient says.
from the
what
patient
patient
side.
is saying, okay. And then other way, if you have that, if you have an objective data, okay, what is objective data?
What we see
We
on
have
the
to
The
object.
data in the form of fact. Okay, it can be, okay, I'm feeling very cold. This is my subjective data. I'm saying the vital sign is 80/60. This is an objective
It is
data.
objective.
Yes. Now understand one thing. If the data is in subjective form, okay, then you have to all maximum most of the time, if the subjective data is given, then you have to think, for an solution or some kind of implementation. Okay. If the okay, I'm so sorry. If the data is in objective form, if the data is in objective form, means factual data, okay, the data in fact, or the data that you have assessed, then you have to always look for some kind of implementation. Okay, like for example, a subjective can be your diagnosis, anything which is clearly straightforwardly mentioned in your question. Okay, second thing is, if you have data in the subjective form, subjective being given by the patient, then you are very unsure about what the question is saying. You're not clear what do you mean by question or what question is asking, then always go for assessment most of the time. Okay, if you don't know what is in the question, understand by choosing an answer which tell you more about a question. Okay, choose those answers which ask more about the question. Understood this rule? Okay, let's read this question again. I'm saying the client was newly diagnosed. Question itself has given me a very, very clear thing that my patient is having COPD. Okay, did you understand what I'm saying? That it has been very, very clearly mentioned that the patient is having COPD. The diagnosis is clear. You know what is happening to the patient. Do you know everything about COPD?
Yes.
Yes,
You know
ma'am.
everything about COPD. Is
Yes.
discharged home. The patient has been sent back home. Okay, on oxygen per nasal prong. Okay, do you know the patient, the chronic patient are your stable patient? Any disease which is chronic is stable. Okay, next come is sent home on oxygen. Okay, the second, then now the question say that which teaching point should the nurse include in the client discharge plan? Do you know about the diagnosis?
Yeah.
Yes, ma'am.
Do you know what question is asking from you?
Yes, ma'am.
Yes.
What
Yes,
question is
ma'am.
asking from you?
Okay, what teaching point
Health
should the nurse
education.
Discharge plan.
Discharge
Nursing
planning.
health edge.
They're
Ma'am,
asking
home
for
care.
discharge plannings. Okay.
Discharge
Now,
plan.
do you know the problem? Problem is not the diagnosis. The problem is this: the patient is with oxygen
With
on nasal
oxygen. Yeah.
prong.
Nasal prong.
Nasal
Yes.
prongs.
The question is this: the diagnosis is this. The problem is this, and you have to do the discharge
Plan.
plan. Okay. First thing, Shubal Khalid. Okay. Now, will you apply petroleum jelly? First thing comes, the first thing the question asking, apply petroleum jelly on, okay, the question is SATA, okay, SATA. SATA means you can choose as much as you can, but understand one thing, in NCLEX, in SATA question, you have a negative marking. Everyone, Priya, I'm saying in
why?
SATA, Uzma,
Why negative? Madam, why negative marking SATA question?
I don't know. They had said that if you choose wrong, we will cut your marks.
Okay.
So for example, if the right answer is 3, okay, and you chose 4 also, then you will only get 2 marks. 1 marks will be deducted from your wrong marking. Understood?
Yes, ma'am.
Yes, ma'am.
Okay. Now let's read this thing. The first option is saying that apply petroleum jelly on lips and nose to prevent dryness and irritation. What does it mean?
You're not supposed to do, ma'am.
What do you mean?
I mean, there are
Dryness.
Ma'am, right?
There is dryness. Yeah, of course, there's dryness. And they're saying that when you keep your patient on nasal prongs, does the patient feel dryness?
yes, ma'am.
Yes, ma'am.
Yes. Patient feel dryness. And you're putting petroleum jelly. Okay. Next, avoid the area where people are smoking cigarettes and cigar.
Yes, ma'am.
Yes,
Why?
ma'am.
Why?
Ma'am,
It affects
smoking is
the
causes of
oxygen.
COPD.
Smoking can trigger COPD.
COPD
No.
patient के लिए ठीक नहीं होगा
No,
smoking जिसके
oxygen
smoking.
tank.
Only one person said the right. All of you are wrong. You have, listen, the problem, the patient is diagnosed with COPD. The problem is that the patient is on oxygen. And if in a room where there is an oxygen present, if you smoke there, smoke, oxygen help fire. Oxygen help burning. Yes, fire will be there just because of oxygen. So you have kept a patient on oxygen, then you have to Okay, just imagine this is the room where there is an oxygen cylinder. So on the gate, you will put in sign of no smoking. Okay. You're going to put the sign of no smoking on the door of a patient's room. Okay. Then this is a good answer. Avoid area where people are smoking. Next, increase oxygen flow at night during sleep.
No, ma'am.
No, ma'am.
I can see no one on my screen. Govind Raj, Kaval,
Yes.
can see no
Not
one on my
not
screen. This is so.
No, ma'am.
no.
You know, ma'am. You know.
Why no? Why?
COPD, they don't need increased
Ma'am,
oxygen.
ma'am, because at night oxygen demand decreases, so there is no need to
Hypercapnia.
When sleeping, that
increase
time
oxygen
oxygen
flow.
demand is.
Well, listen, the problem is with COPD is not
Ma'am,
with
causes of
oxygen. The problem
hypercapnia.
is the patient is not able to remove carbon dioxide. Okay,
Yes.
that's why. Okay, next, place gauze between ears and oxygen tubing to prevent irritation. Will you do
Yes,
this thing
ma'am.
with patient?
Yes,
Yes.
ma'am.
Yes, ma'am.
Yes, ma'am.
Yes.
Do you commonly practice this habit?
Ma'am.
No.
No, ma'am.
Good question. Kawaljeet said that we need physician order. Yes.
Yes.
What is the normal
Yes.
value where patient we can administer oxygen up to?
Ma'am, say the
4
question
liter.
again.
Repeat
4
करें?
liter.
85.
2 to 4
4
liters.
liter is the maximum where you can
Maximum.
administer to the patient without any consent. Okay. Next, request a large pressurized oxygen tank for use during a
No,
car
ma'am.
travel.
No,
No.
ma'am.
What did you choose?
I didn't choose.
Ma'am.
No,
Yes or
ma'am.
no?
No.
No.
Why no?
Ma'am, because as you
If
said
you
that oxygen is not a problem here.
pressurized oxygen
Okay, listen
tank
one
in
thing.
car is not
if
safe.
if the patient is discharged home with oxygen per nasal prong, then you have to give nasal oxygen per nasal prong, and maximum 8
Yes,
liter you
ma'am.
can give through this. 8 to 10, maximum 8 to 10, I think. Why wrong? If you choose wrong, but why?
Yes.
Uh,
It's right, ma'am.
it's not right, it's wrong, ma'am. Already the car produce carbon dioxide too, and the pressurized oxygen, and that's not a good combination, ma'am. Sometimes the car is also closed.
Somewhere correct, but understand one thing, there's a large, okay,
Yeah.
large. When you travel, if we use mini product or large product, girls, we
No.
keep small product, okay, small soap, small makeup, okay. So when you're traveling, why do you need large? Will be pressurized. Do you keep your gas cylinder full at till the brim? No, even when we are cooking, we keep in 1 liter or 2 liter halfway. We did never pressurize this gas cylinder when we are cooking. So never use pressurized oxygen tank, will be large, is a wrong combination. Okay, it can blast during the molecules will collide with each other, and it can cause a blast. So we don't want to use very small and like halfway fill. Okay, avoid use of microwave oven when using oxygen.
I'm
No,
wrong.
ma'am.
Why wrong?
Microwave use is safe with oxygen.
Uzma,
Yes, ma'am.
क्या बोला आपने? What did you say?
Madam, avoid microwave use. Microwave use is safe with oxygen.
Rosaline, what your answer? You can speak. What do you think?
Wrong, ma'am.
No, ma'am.
Wrong.
Okay. Does everyone have microwave in their home?
Yes.
Yes, ma'am.
Yes, ma'am.
So, okay. So this is the microwave. So do you put firewood or do you gas cylinder to burn microwave? No.
No,
Microwaves
ma'am.
are waves are okay. There's a plug. Okay. So plug they produces microwave like this. And this is how your food get warm. Do we use fire? We don't use fire. Microwave can be safely used during the when we are using oxygen cylinder. It does not cause fire. Okay, until and unless you are using it wrong way. Okay, so that's why this is the correct answer. Okay, next. So we don't avoid. We use microwave. There's no need to avoid microwave when we are using fire or when we are using oxygen. So correct answer is never apply petroleum jelly on nose and prevent dryness. Why? Because petroleum jelly is byproduct of petrol. Do you know this thing? When petrol evaporate or when we use distillation technique from you, when we listen, the oil which is yes, 2 and 4 are correct. Listen, one thing, when we use petroleum jelly is a byproduct of petrol. So when we want to take out petrol, so during the crude, when we take crude oil and we distill it at different temperature, okay, that's why we get petrol out of that crude oil. Okay, this is, then you get so many other gases also, like you get it. What other things are associated with petrol? Anyone knows this? Does anyone know we have studied in chemistry? Anyone who has studied chemistry in class 12th? Farhad, Uzma, Roslin, Govind, Zunaid.
Yes, ma'am.
Do you know other product? Mitti ka tel is produced. You know mitti ka tel, kerosene. It is also produced. And so petroleum is also produced. Petroleum jelly is also produced. So it can cause fire. Do not use petroleum jelly. Okay. NCLEX don't like. Lubrication we can use. Any kind of lubrication was there, we can use, but we are not going to use petroleum jelly. Understood? So 2
Yes, ma'am.
and 4 is the answer. Okay. Next, read the next question. Next question is, which information should the nurse include in the teaching plan for the client newly diagnosed with COPD disease? Select all that apply. You have to give health education to patient with COPD. Okay, the first thing, pneumonia, pulmonary rehabilitation program offer very little benefit. True or false?
False, ma'am.
False.
False, ma'am. False.
False.
Wrong.
False. Okay, whenever you are doing the question of SATA, select or that apply, you have to go like, this question is true or false. So go like true or false. Okay, think like this. Okay, so next, you all have said false. Okay, I will keep this point in mind. Pneumococcal vaccination is contraindicated for clients with this disease. True or false?
Wrong.
False, ma'am. We have to give
False.
pneumococcal vaccine
High
every 5
humidity
years.
increase the effort of breathing.
True.
Yes, ma'am.
Yes,
True.
ma'am.
True or false?
False,
True.
ma'am.
True.
What's Janta going with? True or false?
False, ma'am.
It's true.
True,
Ma'am,
ma'am. True.
No, ma'am, you
please
told
right.
on Saturday that we have to give proper vaccinations to these two COPD patients.
So I'm talking with option number 3. Farhad, are you lagging
Ma'am,
behind?
true है. Breathing difficult in COPD patients.
Next. A bronchodilator with MDI should be available.
Yes, ma'am.
True,
Yes,
ma'am.
ma'am.
Yes, true.
True, ma'am.
Smoking
It's true.
cessation is important to slow or stop the disease progression.
True, ma'am.
True, ma'am.
True.
3, 4, and
Ma'am.
5.
What do
No,
you
I
think?
don't
What should
go
be the
with
answer?
3.
Listen, pneumonia rehabilitation program offer very little benefit. It is wrong.
Wrong.
The patient is COPD and rehabilitation is the only one option. You can go for smoking cessation. You can go for deep breathing exercises. You can go for spirometry. Okay, so these are the good exercises that we want. It provides good benefit, not little benefit. Okay, it is chronic diseases. We really want our patient to perform good breathing habit. Okay, next, pneumococcal vaccine is contraindicated. No, I said we will give. So this is also wrong. This is also wrong. We will give pneumococcal vaccine. Next,
Yes, ma'am.
high humidity increase the effort of breathing. Yes, yes.
Yes.
So whenever there is so much of humidity, the water wave, our environment saturated in water waves, vapors. So it will become very difficult for us. Or as we ascend up, as we go away, like away from the mountain, sorry, away as we go up at the sea level, so there is less pressurized oxygen. Okay, as we go high up to altitude level, it also increase the effort of breathing. This is also true. Next, smoking cessation is important. Yes, smoking cessation okay. Next, a nurse is assessing a chronic with chronic emphysema. Does your question provide with the diagnosis? Yes, you already know the
Yes.
patient is emphysema. Do you know everything about
Emphysema.
emphysema? You know everything
Yes,
about
ma'am.
emphysema. What finding required immediate intervention? What do you do as immediate to the patient? Use purse leaving and prolonged expiration.
Yes,
Circum
ma'am.
immediate
Means
intervention.
two.
What will
No,
be immediate
ma'am.
activation?
Number
Which sign
3
and
is the
symptom
one.
is immediately you're going to respond? Crackles or escalated posterior halfway up to the left lungs, a pair of barrel chests. You have to tell me
Ma'am, two.
which sign and
Cyanosis.
symptom you are going to keep in mind that it is very important for you all.
Cyanosis, ma'am.
Ma'am, cyanosis.
No, ma'am. Already. Sinus is one of the symptom, ma'am.
Think.
Yes.
So I'll go with 3.
Immediately intervention.
Anyone, what have you choose? Like you tell me your answers. You have already done this question.
Ma'am, two. Two.
Ma'am.
I have
Cyanosis.
given these questions for the homework. Priya, you have to choose only one answer. You cannot choose two.
Ma'am, two.
Okay. Everything that it is true.
No.
Can you
Ma'am,
tell
it
me
is
the other
3.
name of
No,
emphysema?
no.
3.
We are. I'm
Pink blotters.
going to third. Third one
What
is
is the other
correct one
name of
for me.
emphysema?
Pink blotters.
That
Other
is
name of
why.
emphysema?
Ma'am, chronic disease.
I'm not going
Ma'am,
to talk to you. You're not
COPD.
giving me good answers. I have clearly teach you yesterday, day before yesterday. What is other name of emphysema?
Ma'am,
Shashikala,
COPD.
Priya, Rupa, Govind Raj, Subal Khalid.
COPD.
Chronic bronchitis.
Chronic lung disease.
Class.
Ma'am, COPD.
Class.
मैम
अब तो इसका मतलब ये है कि आपको मेरी बातें समझ में नहीं आती अब. Now it means this. You're not giving me correct answers, and this is very wrong. This is the first time happening in my career that what I have taught something and the students are not replying in back. Not a good sign. Subal Khan, Govind Raj, were you present in my class? Bilal Khan, Junaid. What is COPD? What is COPD?
Obstruction.
Do not give me
Emphysema
full
Chronic,
forms.
plus
Do
chronic
not give me
obstructive
full form.
pulmonary disease.
I don't want full forms. COPD is comprised of chronic bronchitis plus emphysema.
Emphysema.
This is your COPD. Very clearly, I have explained you this thing. What is chronic bronchitis? Is your blue blotters, cyanosis, and there's weight gain. What is emphysema?
Bulla
There's
formation.
coughing. There's coughing present. Okay. Yes or no?
Yes.
Did you
Yes,
forget
ma'am.
this? I taught you all this thing. Chronic bronchitis, do you remember? Told you they are calling it blue blotters. Emphysema, I have taught you all this thing. There is bulla formation. How this is formation? I taught you this is
Yes, ma'am.
pink puffers.
Yes, ma'am.
Pink puffers.
Pink puffers.
They are called as pink puffers.
Pink
Chronic
puffers.
emphysema is pink puffers, and chronic bronchitis is your blue blotters. And COPD is chronic bronchitis plus emphysema. Do not give me full forms. Come on. You're not kids. You should know things very clear at your tips. This is not good. Okay. Now, did I told you that pursely breathing is a very good exercise and prolonged expiration is what we actually want. We want them to do pursely breathing, and I will not give it as an immediate intervention because this is what we actually want from this patient. Second option is your circumoral cyanosis. This, you want to hold it? Most of you are giving me this answer. Okay, let me hold this thing. Next is your crackles auscultated posterior halfway up to the left length. Does anyone think that this is the answer?
Yes, ma'am.
Who's thinking this is as answer?
Me.
Rupa, why?
First thing is crackling is emergency, ma'am. And posterior half up of the lung is like silent.
Posterior half means
Like half of your lung.
posterior halfway up to the left lung.
Yeah. Upper lung, upper part.
Upper lung. Okay. Next. Okay. Appearance of barrel chest.
It's a normal sign and
This is a
symptom.
sign and symptom of emphysema. Everybody knows this thing. Yes or no?
Yes, ma'am.
Yes.
Yes or no? Bilal Khan?
Yes, ma'am.
Yes.
Yes. This is what we know expected. This is no that is expected. Here the patient is saying circumoral parallel between your crackles auscultated posteriorly halfway up to the left lung. Very good. Auscultating a crackle sound means crackle sound is heard when there is a fluid in the lung cavity. Okay, that's why before this thing we are keeping this thing in a priority because cyanosis, little bit of cyanosis is expected in the COPD and your emphysema. Okay, because we know there's a difficulty in the perfusion and ventilation ratio. That's why the oxygen cannot reach to the body and there's circumoral pallor. Okay. Okay, circumoral pallor indicate that the body is not getting oxygen, and the second thing is that crackles indicate that there is a fluid in the lung cavity. Okay, so we are keeping this as a parity. Okay, second thing, next question. The nurse is assessing a client with COPD. Which finding required immediate intervention? Do you know what patient is having? Do you know the diagnosis of the patient? Do you know
Yes,
what is
ma'am.
the problem? Okay, now the question is asking intervention. Do you know what intervention means? You have to do something.
Ma'am, 4.
No, just wait. Let me read this thing. Distant heart sound, diminished lung sound, inability to speak, pursely breathing.
Unable
If
to.
you have not answered this question to me correctly, I will just not be good with you all. Honestly, I'm telling you. So I will not talk to you. I will just come straight and just teach and go. सबसे बड़ी मात चित से दे उतार. इसका मतलब पता है क्या होता है? You know what does it mean? Mean that if you want to hurt someone, if I want to hurt
Partially,
the most someone, okay, listen to me. If I
partially
want to
breathe,
hurt
ma'am.
someone,
No, ma'am.
who's-
No hurt.
if I want to hurt anyone, the more. Wait a second, let me complete my sentence. If सबसे बड़ी मात चित से दे उतार, इसका मतलब ये होता है, if I want to hurt someone the most, I will remove them from my heart. I will not give the respect. I will not show the love that I used to show. And this is the most painful thing. If you will not study that you're doing, I'm very, this is the first batch I have in my life who does not study. None of you study. And I can clearly see this thing from your faces and from your answers. I'm asking the basic questions and not getting from response. And this is not a good sign. This class knows it for just enjoyment that you're coming, and I'm telling you things, you have to answer me back. Understood?
Yes, ma'am.
Everything should be on the tips. Other way, then I will not give you the respect. I will not show you the love that I used to show you. And this will be more hurtful to you all. Okay? Honestly, I'm thinking good of you. That's why last time I'm warning you. Whatever I'm teaching you, you should have them on your tips, on tips. Tips mean tips. Even if you're dreaming, dream of the things that I have taught you. And use, open your brain and study in the class. Next time I should not have anyone not giving me correct answers. Okay?
Okay.
Okay, now tell me the answer. What do you think that if a patient is having COPD, which finding? Finding means which sign and symptom require immediate intervention. It means that which sign and symptom among these things will you keep as a priority? You will keep it as a
Fourth.
priority. Which sign and symptom do you think that the patient require? Which sign and symptom shows that the patient is the more distressed? Shashikala.
Should be three. Maybe
Fourth,
four.
ma'am.
Firstly,
Fourth, ma'am.
firstly breathing.
Partially breathing, ma'am.
Inability to speak.
Shashikala,
Four.
pursely
First
breathing.
you
We
do the
want patient. Every time they breathe, and we ask them to do pursely breathing, Shashikala. This is what we want. This
That
is so
is
normal
immediate
in them.
intervention.
What?
Intervention, no, ma'am.
Okay.
That's why I said that.
Immediate intervention means, okay. No, you're getting it wrong. You're getting it wrong. Okay, then let's read it again. Okay, let me tell you, let me explain you this question again. Okay, a nurse is assessing a client, means a nurse is looking at a patient. Okay, patient, you're looking at a patient and you see the patient have a diagnosis of COPD. Okay, now which finding? When you were assessing the patient, you had seen, okay, there's a distant heart sound in the patient. Secondly, there's a diminished in the lung sound. Third, there's the inability to speak. The patient cannot speak. And third is the patient is doing pursely breathing. Okay, the patient is doing pursely breathing. The patient cannot speak. Okay, and the patient is doing like
I
this.
think
Okay, when someone can't breathe, they will do like this. They will do
Yes,
like
ma'am.
this. The patient is showing you these kind of symptoms. Third is when you're auscultating their heart sound, you cannot feel their lung sound. Okay.
diminished lung sound.
Diminished
Second one,
means they decrease in the lung sound. You
lung
cannot
sound.
feel that lung sound. And and third, first is distant heart sound, means the heart sound is not clear. It's coming from very far. Okay, it's coming from very far. So among the things, which one will you keep as a priority?
Inability to
Diminished.
speak, ma'am. Why means the patient is struggle to speak, then the patient is struggle to breathe in everything. So we have to immediate intervention for that.
But why a patient is unable to speak? Because there's closure of the airway and airway is blocked. This
Yes,
is the
yes.
priority. Don't I taught you about status epilepticus, sorry, status asthmaticus. I told you very, very clearly. I mentioned that sign. Inability to speak means there is a complete blockage of
Yes,
the
ma'am.
airway and the patient is then right. Then why are you not thinking that way? Okay. Now did you understood?
Yes, ma'am.
Shashikala,
Yes, ma'am.
everyone.
I think second
Yes,
one,
ma'am.
diminished lung
Yes,
sound.
ma'am.
Okay. Okay, Govind Raj. Okay, let's understand why this is not the answer. Diminished lung sound means okay. So in COPD, there is there is pus formation in the bronchial, okay, and there's some
Yes.
obstruction in the airway. There's some sort of obstruction in the airway, complete obstruction. You know the normal value of SpO2 we consider as 88% till 100 is normal
100.
SpO2 value of a patient with COPD. Okay, so this is an
Yes.
exception.
Okay.
Okay, and similarly, their airway has been fused together. So when you have a lung sound, you will not able to clearly feel their lung sound because there's an obstruction, and there's some
Yes.
kind of obstruction is present throughout their lifetime. Okay, that's why this is not the answer. And distant lung sound, obviously, whenever you are trying to hear the heart sounded, the heart, okay, heart is placed in between your lungs.
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 Yes. So just imagine this is my lung. Okay. So here will be my heart.
Yes.
So there's a barrel chest. The
Barrel
anterior
chest.
posterior diameter increases in the patient. That's why you cannot hear the heart sound very clearly in such kind of patients.
Okay.
Okay. Understood
Okay.
that why this is not then no why we are not keeping this in priority. So among this thing, this will be the priority because there's an it indicates that the patient there's no passes of air and patient cannot talk. That's why this is the priority. Understood?
Yes.
Yes, ma'am.
Okay.
Yes, sir.
So this is all about that. We have discussed the question and answer. I will give you an answer for the rest. Okay. So let's talk about some important things that we need to discuss. That is that is your pneumonia. Today's topic is your pneumonia. No break.
Okay.
No break for today. So you have to just listen to me now. Because you're not studying, I'm not going to give break.
Okay.
Very strictly, I'm saying this thing. Okay. What do you mean by pneumonia? Anyone? Can anyone explain me pneumonia? In your word, I will. It's okay for me.
Madam, pneumonia is an infection of the lungs.
Very good.
Pulmonary
Infection.
tissues, infection of pulmonary tissues.
Very good.
And
Infection of
alveoli.
pulmonary tissue. Yes. Anything else?
Inflammation
Anyone
of the
else?
alveoli.
Sorry.
Inflammation, it is an inflammatory condition of the lung.
Cannot understand.
I said it inflammatory condition of the lung.
Inflammatory. It is inflammatory. Yes, it is inflammatory. But inflammatory due to infection. Okay.
Yes, due to infection.
Life-threatening case.
Not always. Not always. Not always. Okay. So let's understand pneumonia. So if anyway, whenever I say pneumonia, so there are three things which is associated with pneumonia. First is injury, damage, inflammation of the lung tissue.
Lung tissue.
Okay. It is, you can also say an infection of a lung tissue, but more precisely, it can be due to injury, damage, or inflammation of your lung tissue is pneumonia. Okay. So whenever there will be an injury or there will be damage or there is inflammation, there will be a release of transudate, or exudate. What is the difference between transudate and exudate? Exudate, transudate, whatever it is. Does
And
anyone?
inhale, exhale.
No. Not inhale and exhale. What is transudate fluid? What is exudate fluid? Do you know this X means from outside, away, X? X for extra.
Outside.
It is not, yes, outside, which something is extra. Exudate means, like for example, there's a bacteria. If this bacteria will produce toxin, I will call it as exudate. Okay? For example, if there's my lymph and the lymph tissue release fluid, I will call it as transudate. Okay? The fluid which is normally present in our body, if this increase in the number of value, I will call it as transudate. And if it is something which is not present normally, which is not present in our body, and anything which is increasing, this is called exudate. Okay? Exudate is from outside the body, and transudate, our body itself is producing something. Understood the difference? Okay. So, whenever there is a damage, injury, or inflammation, our body will produce transudate or exudate, for example, fluid, which get accumulated during a pneumonia. Understood? So, there is a fluid filled in your lung cavity also. Clear? Okay.
Yes.
So, now let's understand, very, very important thing is, what is a causes of pneumonia? Does anybody had heard of different type of pneumonias? Just tell me pneumonia. What?
Aspiration pneumonia.
Very good. Aspirational pneumonia. Yes. Anyone else?
Ventilator associated pneumonia.
Ventilator.
Very good.
Yes.
Ventilated associated pneumonia. Bilal Khan,
Yes, ma'am.
any example of pneumonia if you remember?
Bacterial pneumonia.
Bacterial pneumonia? Yes.
नहीं, वो
Pneumonia
तो
due to infection.
काजीज में आता है ना, बैक्टीरियल तो.
Anyone have heard of inhalation pneumonia? Inhalation pneumonia is there. There's another pneumonia which is called as microciliary clearance disturbance pneumonia.
Allergic
Sorry?
allergic pneumonia.
No. Allergic is asthma.
Asthma.
No, it's not okay, this thing. Okay, so first of all, let's talk about your aspirational pneumonia. So, what do you mean by aspiration?
Food particles enter into the trachea.
Okay, very good.
It's enter into the
Yes.
lung cavity.
Lung
So
cavity.
let me show you good. Okay, just imagine. No, just imagine this is your esophagus, and behind your esophagus you have a beautiful airway which is called as your trachea. Okay, so your trachea is your this. Okay, and this is the lung cavity. So there is an epiglottitis
Yes, ma'am.
which cover this trachea when we are eating food,
Eating food.
right? And when we're eating food, this trachea get closed, so food particle does not usually enter our airway. But
Lungs.
just imagine one thing: if the patient is on any kind of sedative, okay, or the patient is in coma, okay, or there's decrease in the gag reflex, or there's a decrease in the cough reflex, and decrease in the swallow deflect, or for example, you're bringing back a patient from anesthesia. So the patient cannot swallow. These muscles are very relaxed. The muscle cannot swallow. So what will happen? So just imagine you have just given a food to the patient. Okay, listen one thing, very important thing. So who performed the swallow test after bringing back a patient from anesthesia?
Ma'am,
Who performs swallow test when you bring back a patient from OT?
yes, ma'am.
Who performs swallow test after a patient is coming from anesthesia? Do you know what swallow test is? Anyone? Farhad, Subel, Junaid,
Just
Rosaline?
don't know.
Giving some little amount of water or anything. It's
Okay. With
No,
Good
Dr.
for
the
that.
RN
gag
can do.
reflex.
With Dr. RN can do.
with
Yes. With
uh
Dr. RN can do. But who is the person who is authorized to do this thing? Listen one thing. There's a special person who is known as speech language pathologist. Speech language pathologist. They are the person who will perform swallow test before you introduce any kind of food to a patient who is coming from OT. And this is very important line.
But
You
in
need to remember.
India, this work doing the nurses only.
In India, we are not giving an example of India. We
Yes.
don't care now. So I know what happening in sometimes, you know what, when I was working in a hospital, so so I was saying when a patient is having decrease in the gag reflex, okay, there's a difference in the gag reflex or cough reflex, or the patient cannot swallow, okay, or the patient is under anesthesia. So these muscles are very, very weak, okay. So what happened whenever whenever you're eating food particle, these food particle land into your airway and they live in your, because you cannot absorb food from your windpipe. Okay, there's no cilia present. You cannot absorption cilia. You cannot absorb food from your windpipe. Does anyone have a power to absorb food from windpipe? Among of you, Bilal Khan, can you digest food from your lungs?
no, ma'am.
Pakka? Okay.
Mhm.
So what happened? The food particle will land over here, and after some time, the bacteria colony will come and will grow, and they will grow like anything. And when the bacteria will grow, they will produce toxins from their body. Okay, the toxin will be covered, and they will infect your airway very, very badly. Okay, and this is called an aspirational pneumonia. Okay, the causative microorganism for aspirational pneumonia is your Klebsiella. Klebsiella, if you have ever heard of this Klebsiella
Epsilon.
bad bacteria, Klebsiella, anaerobic bacteria, S. aureus, Cephalococcus aureus. So these are the causative agent which going to grow on your food and just do the happy party in your lungs and you will get pneumonia. Understood? The first cause of
Yes.
pneumonia. Okay. Coming to the next cause of pneumonia, that is the inhalation in pneumonia. Okay. How come inhalation pneumonia? Okay. Just imagine you're living in a crowded, very, very crowded place like Mumbai or Beijing, some China. The people are living in a very, 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 very near about them. So whatever they are exhaling out in the airway, so it's all scattered in your airways. So what happened? So whenever there is an overpopulation, there is an increased risk of mycoplasm mycoplasm pneumonia. Have you heard of this mycoplasm? Okay, so this bacteria or chlamydia, anyone know this chlamydia? What is chlamydia? Is a sexually transmitted diseases. Chlamydia is a bacteria which is, but it can also travel through inhalation. Okay. Okay. Next, influenza. Okay. Next, there's one thing I want to talk about, which is very, very important. That is histoplasmosis. Does anybody heard of this histoplasmosis? You must have heard this histoplasmosis.
मैम रिपीट करें.
Okay. I'm saying there's another type of pneumonia that is called due to inhalation of bacteria. Okay, so whenever a people who are living in very overcrowded places. So, for example, a patient is suffering from chlamydia or mycoplasm or influenza or histoplasmosis. So what happened? The bacteria are saturated in the airway. So when we inhale this bacteria, we inhale this bacteria into our airway, and this bacteria goes into your lung, and you will get pneumonia.
Yes, ma'am.
Yeah.
Initially, the COVID-19 was also affecting your lungs. You know,
Yes.
initially they were showing the sign and symptom of pneumonia. You know, after the treatment of COVID-19, the patient was they were getting black fungal pneumonia. You remember in hospitals?
Yes. Yes.
Yes, ma'am.
Okay. There's one thing I want to talk about, that is your histoplasmosis. Does anyone ever heard of it?
No.
No,
Okay.
ma'am.
Histoplasmosis is a kind of fungus which is usually, yes, very good. Histoplasmosis is a kind of fungus which is usually grown with a bird poop. BIRD, bird. You know, bird potty. So whenever those people who are working with a bird or poetry farming means not a poetry means not a piece of paper or poem. Poetry means murgi palan, murgis. So people who are dealing with birds, especially chicken, hens, so their so their potty gets infected by histoplasmosis and is saturated in the airway, and these people get a fungal kind of pneumonia which is caused due to histoplasmosis. Understood till now?
Yes, ma'am.
Yes.
Two type pneumonia. First is your aspirational pneumonia. You know why? Because there's no cough. Okay, so you cannot cough, or you cannot sneeze, or there's decrease in the gas reflex. You cannot swallow, so the food is entering in your food pipe. So you know, whenever whenever food enters your food pipe, we like expulsive force of contraction we put, and we cough, and we try to expel the food out. Everybody must have. Okay, if I'm talking to you all and I'm eating food at the same time, so my body will get confused. Okay, so mistakenly if the food enters my food pipe, I will cough vigorously, and I will try to remove this food. But if I'm in coma, if I'm in coma, or if I'm in coma, or the patient um if the patient is having stroke, okay, when their body is not working, this paralysis of the lung laryngeal muscles, so we cannot cough, so the food will remain in the food pipe, and this will attract bacteria, and the bacteria will grow, and hence I will get pneumonia. Or even if I'm working in a poultry farm and I'm inhaling so much of histoplasmosis, and my lungs is getting filled with histoplasmosis fungus, and hence I'm getting pneumonia. So this is the second cause of pneumonia. Third is your something you don't have to remember the name, but understand what I'm trying to say. The patient is having microciliary clearance disturbance. It means that the airway is lined with your cilia.
Yes, ma'am.
Okay, so just imagine the cilia are not working. Okay, it can due to your COPD. You have damaged your cilia in your chronic bronchitis, or you have your bronchoatelectasis, okay, or due to the cystic fibrosis, bronchoatelectasis or cystic fibrosis, or any disease which in turn causes your damage to the cilia. So when there is no cilia, who is going to expel out any kind of food particle, any kind of bacteria away from your lungs? No one, and hence you will be prone for pneumonia. Okay. Hemophilian influenza, pseudomonas, so they will get a chance to increase, and they will cause infection in your body, hence pneumonia. Third is your IV drug users. So the people who are using drugs, drugs, what are drugs? Who's living in
Sedation.
मैम
no
जो people नशा करते हैं
Sedation.
a drug. IV drug users sedation नहीं होता है. कौन कौन बताएगा मुझे IV drug users कौन होते हैं?
Narcotics.
अरे ना.
Cocaine.
Yes, now you're getting any male.
Oh.
What does this O mean, Sashikala?
I thought drug means anesthesia.
That
I
also
thought
drug
that
only. That also clinical means drug only.
That's not drug. No, that's not drug. We are talking about drugs.
medications.
Govind Raj, are you getting my point?
Uh-huh.
The drugs where you're working, like narcotics, the people who are smuggling
Yes.
drugs and they're
Smuggling
injecting in their
drugs. Yes.
bodies. Okay, so they are like they're sharing their needles. Okay, so I don't know. You have seen your documentaries or something like this. Does anybody have seen any kind of documentary or have seen people? I have seen so many people getting affected with IV drugs. So the whole world is getting polluted with such kind of mentality. And the people who are sharing drugs, so what they're doing. So, like for example, this is their vein, so they're putting this injection into their body. Okay. And due to this injection, there's a growth of bacteria because it is being shared by so many people. So this bacteria will grow and will infect your lungs. Lungs are the primary location of, they will come through your blood, they will grow into your pulmonary and they will call pneumonia. Okay.
Yeah, I think that
Especially your
madam, I have one doubt. So usually when we are admin the injection, we clean with the alcohol swab. So who are using that drug, not cleaning that area. So directly inject, right? Due to that purpose only bacterial infection will grow.
listen, I want to tell you one thing. Our body is in your body act as a host for so many good bacteria and so many opportunistic bacteria. Your body, our face is having so much bacteria. Our body have bacteria there.
Yes.
Staphylococcus aureus is the normal bacteria which is present in the body, and our perineal area is also having good bacteria. Okay, our gut is also having bacteria, our face is having, but
Yeah.
when these bacteria from your body through they are present in your skin, Staphylococcus aureus present in your skin. So when they will
Okay.
get opportunity to enter your body, when their immunity is
Right.
low, or when you are providing where then opportunity to go and infect your body, when you're making yourself very immunocompromised, this bacteria will grow and they will grow into your body. Okay, so
Okay.
just imagine a patient who is an IV drugger, him or her, their immunity itself is very low.
Ah, right. Okay.
Do you agree? Do
Yes.
you
Yes, ma'am.
agree? Now they're sharing needles. They don't know how to do, just they don't know that this I want, their single thing is that, okay, I want this drug into my body. Simple this. They don't care about needles. They use rusted needles.
Yes.
They
Yes.
use they do you think they will use, first of
Yes.
all, I will use alcohol. Now I'll put it, they don't, they just want drugs. Simple is this.
Yeah.
So this is how
That's
they already they are very immunocompromised, and you're providing them opportunity for the bacteria to go into your body and affect your lungs. Okay, so through blood, it can cause infection.
yes. I
Okay,
got it.
Staphylococcus aureus is the main causative agent. Next is your people who are immunocompromised. Our airway, we just take everything from our body, from outside environment. Okay, so immunocompromised people. Can you tell me 5 people who are immunocompromised? Nayak Muhammad.
Autoimmune disease condition,
5 disease
cancer
condition,
patients,
cancer,
Dialysis patient,
HIV.
cancer patients,
CKD.
Maybe, ma'am.
Let's move on.
They are also immunocompromised patient.
And
Yes,
patient
yes.
with
All
AIDS.
Dialysis
immunocompromised
patient
people.
is also. Ma'am,
Pneumonia,
patient is also
ARDS,
compromised.
Dialysis.
Sorry.
pulmonary
Dialysis.
effusion,
cancer patient, ma'am, autoimmune disease condition patient,
autoimmune disease patient.
ma'am.
What's going, ma'am?
HIV. HIV, dialysis, cancer.
So, which of the patient who is immunocompromised?
Cancer patients,
Cancer patient.
More.
autoimmune condition patients,
Okay. Anything else?
HIV,
HIV, AIDS,
diabetes,
HIV. More. Diabetic mellitus.
diabetes,
The
Diabetic
patient
mellitus.
who was on steroids.
TB
Okay.
patient.
Immunosuppressant. The patient who are on immunosuppressant. Okay. Next, sexually transmitted disease are patient who are more prone for infection. Okay. So these are the patients who are immunocompromised and they are very, very prone for any kind of infection. Let's start again. Can you all see the screen? Yes or no?
no ma'am.
Don't see the screen. Now can you see the screen?
No ma'am.
Okay. So now let's understand what do you mean by, can you see the screen now?
yes,
Yes
ma'am.
ma'am.
Yes.
Now tell me, what is the difference between hospital acquired pneumonia, ventilated associated pneumonia, or what is the difference between community acquired pneumonia? You must have heard 3 types of pneumonia. Can anyone just tell me what is all this thing? Does anyone know the difference?
Hospital acquired pneumonia means
Patient will stay prolonged. So cross infection will affect the pneumonia.
No. No. Read the line again. You will get your answer.
Get it from the hospital, ma'am.
Yes. The pneumonia that a patient is getting from hospital. Hospital acquired means pneumonia which is acquired via hospital. How will you define that the patient is getting pneumonia from hospital or already the patient has pneumonia? So there's a rule. If the pneumonia is occurring after after 72 hours of admission. Okay. So it means that earlier when you admitted the patient did not have pneumonia, and after 3 days the patient got pneumonia. It is known as hospital acquired pneumonia. Understood?
yes ma'am.
Yes, ma'am.
Okay. So जब आपने पेशेंट को एडमिट किया 3 दिन के बाद पेशेंट को निमोनिया हो गया, इसका मतलब क्या है? हॉस्पिटल एक्वायर्ड निमोनिया. ओके. नाउ let's study about ventilated associated pneumonia. Ventilated associated pneumonia means when you kept the
Patient
patient
on
on
It's on
ventilator.
ventilator.
Patient on
when you
ventilator.
kept yes, so 72 hours later, after keeping the patient on ventilator, a patient got
After
pneumonia. So the
70,
timeline is 72 hours. So hospital acquired pneumonia, ventilated acquired pneumonia, and there's one more thing which is called as community acquired pneumonia. It means that when you kept a patient, when your patient was admitted in the hospital, and in less than 72 hours, a patient got pneumonia. It means that the causative bacteria was from the outside. Okay, now the patient is showing the symptoms of pneumonia. Understood? The community
Yes
has acquired
ma'am.
pneumonia. The time now is 72 hours. Okay, if the less than 72 hours, it means it is due to community. If it is more than 72 hours, it means that either it is due to the ventilator or it is due to the
Or a
hospital acquired.
hospital.
Understood the difference?
Yes.
Yes ma'am.
Okay.
yes, ma'am.
Okay. Okay. Now let's understand what are the features of pneumonia. What are the features of pneumonia? Okay, the features of pneumonia is, so is there infection?
Fever.
We are talking about bacterial growth, virus
Fever,
growth, fever.
cough,
So whenever we have infection, yes, very good. Fever,
Fever.
cough,
ma'am, fever, cough,
rigor,
yellow sputum,
yes. Yellow
Shortness
sputum
of
is
dyspnea,
breath.
not an, you cannot say yellow sputum, okay. Sputum.
and fine
Shortness
and
of
coarse
breath.
crackle,
मैडम
Right.
चेस्ट
Shortness of
पेन
breath.
होगी, shortness of breath होगा,
Yes.
Restlessness,
Shortness
agitation,
of breath,
crackles,
confusion.
wheezing,
crackles,
Ma'am,
crackles when
final
there is
course
Increase the
smoking.
crackles.
Yeah,
fatigues.
crackles. Yes,
Increase the
crackles.
fatigues.
Dyspnea.
Dyspnea. Yes.
Dyspnea.
Okay, do not say yellow sputum. Just say productive cough. Okay. A better word to say is
Ma'am, blood
productive
sputum.
cough. Lung consolidation. So there's sputum all over lung. So lung become consolidated.
Ma'am, final course crackles.
Crackles, yes. Okay. Now I want to explain you one thing. So just imagine this is my alveoli. This is my alveolar duct. This is my alveolar duct. And alveolar duct terminate into alveoli. Alveolar duct is terminated into alveoli, and this is my capillary which is all around this alveoli. Okay, there are, I'm just making it over here. So what is happening? So okay, does anyone know about hemoglobin association dissociation curve? Have anyone heard of this? Yes or no? Does anyone know? Just say no. If you know, then say yes. Farhad? Farhad,
Yes, ma'am.
do you know what
Yeah, I can hear.
hemoglobin association dissociation curve?
Oh, ma'am, I don't know.
Okay, don't
If
know.
I knew it,
So
ma'am, I would
let
have
me
answered.
explain you. Okay. I thought that you were lost and found. That's why we're bringing you back. Okay. So what happened? Okay. Listen, your blood comprised of hemoglobin? Yes or no?
Yes, ma'am.
And in your alveoli, you have oxygen? Yes or no?
Yes, ma'am.
So when we're talking about at lungs level, we are saying that we want our oxygen to associate with our hemoglobin. This is called hemoglobin association. And at a cellular level, okay, if I say this is my tissue, a cell, and this is my blood vessel, and here, and over here, I have my hemoglobin, okay. Hemoglobin is associated with oxygen molecules. Now I want my tissue to get oxygen. So I want my hemoglobin to dissociate with oxygen. Over here, I want my hemoglobin to associate it with oxygen. Over here, I want my hemoglobin to dissociate with oxygen. So this is known as hemoglobin association dissociation curve, and it depends upon so many things. It depends upon so many things: temperature, your pH, your oxygen level, so many things. Okay, but so this is something on hemoglobin association dissociation curve. Now, what's the importance of this thing? Okay. Now, when a patient is having pneumonia, in pneumonia, the alveoli will get filled with fluid. Transudate, exudate will fill up in your airway. Yes or no?
Yes, ma'am.
Yes or no? So
Yes, ma'am.
now it will thicken this area between your blood and your capillary, your blood and alveoli. So now it becomes very difficult for your oxygen to get involved with hemoglobin. So there will be decrease in a perfusion. Yes or no?
Yes,
Your
ma'am.
oxygen will not be able to get perfused with the hemoglobin
Association.
or into the blood, because there will be difficulty in hemoglobin association. Okay, because there is an fluid in your alveolar cavity. This is called decrease in the perfusion. This is called decrease in the perfusion, and you will also have difficulty in the ventilation. You will not able to. What is ventilation? Is ventilation simply means bringing air into the lungs or removing air out of your lungs. It is called ventilation. Okay. So there will be a problem in ventilation also, because there is so much of productive cough. Your airway lines are so filled with thick sputum, mucus. So there is difficulty in ventilation. So there is a decrease in your ventilation and your perfusion. Perfusion is denoted by Q. So there is a decrease in the ventilation perfusion ratio. Your body will not get good amount of oxygen. Understood this thing? Now understood one thing.
Yes, ma'am.
In your heart, there is an aorta. Okay. In your heart, there is an aorta, and aorta is lined with chemoreceptors. Aorta is lined with chemoreceptor. I have told you earlier. So when there will be
Yes, ma'am.
decrease in the VQ, when the blood will reach to your heart, into your left atrium, then your left ventricle. Okay, left ventricle, then aorta. So in aorta, there is a chemoreceptor which will assess the quality of oxygen in the blood. And now they will consider that this blood is basically you are having network problem. Can anyone say? Can
Yes,
you hear
ma'am.
me,
Your
Shashikala?
voice breaking.
Achha, okay, my voice is breaking.
Your video also stucking, ma'am.
Is this clear now?
Yes, ma'am.
Now can you all hear me and see
Yes,
me?
yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
So where was the last I was? So what was the last topic you heard from your end? Let me see. I was saying that there is a
Yes,
decrease in the
yes.
VQ, ventilation perfusion, and when the blood will receive back to your when the blood will receive back to your heart, what will happen there? The blood will have less oxygen, so the
Less oxygen.
chemoreceptor will get triggered and they will increase your heart rate, because we want more oxygen, so we will pump more blood. So there is heart rate, and there is increase in your respiratory rate as well as your heart rate. So these are the also two signs. So whenever your patient is having any kind of respiratory problem, that's why
Heart
your
rate will
heart
be.
rate goes up.
Yes.
Okay, so there's increase in the heart rate, there's increase in the respiratory rate, they decrease in the ventilation perfusion ratio, there is productive cough, there is fever, there is shortness of breath, there is dyspnea, and there is lung consolidation. And understand one thing, there is something called tactile fomitus. Does anyone know what is tactile fomitus? Okay, now understand one thing. Okay, just put your ear on your table and scratch. Put your ear on the table and scratch. Everyone just do this thing. The sound, and just scratches like this in the air.
Yes.
Yes, ma'am.
So in which way will you hear the sound more?
More scratches sound will be there, ma'am.
When you are putting your
Like,
ear on the table
yes, ma'am.
and you're scratching, so you will hear more sound, because air travel faster in a solid media. This is what we know. Okay.
Okay. Okay.
So now there's something called tactile fomitus, which when we keep our hand like this in your back of a patient, if I don't have something to say, so just imagine. Can you see this thing? So when I'm keeping a hand on the back of the chest, and I'm asking patient to repeat this 99, 99, 99. So 99 will produce an sound, a vibration, which will follow all over lungs. So as in pneumonia, there is consolidation. So the vibration will increase in a lung of a pneumonia patient. So they is called increase in a tactile fomitus. Understood? So there will be
Yes.
increase in a
Yes, ma'am.
tactile fomitus because there is consolidation consolidation in your lungs, and sound travel faster in a solid medium. That's why you will hear a high tactile formitus. Understood what is tactile formitus?
Yes, ma'am.
Yes.
Okay. Okay, and you can call it a bronchophony also. Understood? Okay, can we just straightforward move to the complication? So the complication is your parapneumonia influenza. Parapneumonia effusion. You will go home and you will study about this topic. Okay, what is effusion? Effusion. Okay. Second thing is the emphysema. Emphysema means this is okay. Just emphysema means this is my lungs. Okay, and this is my cavity. And when there is a pus,
Pus in the pleural cavity.
very good. Pus in the pleural cavity is called emphysema. Emphysema. Very good. Pus in the pleural cavity is called emphysema. Okay. Then you can also have lung abscesses. Abscesses mean फोड़ा. तो गर्मियों में ना इतने फोड़े होते थे ना बचपन में. Do you remember anyone who understand Hindi? So whenever we were kids and it's a very hot, humid time and we're just playing, every time we are just playing here and there, barefoot. We're not caring about anything. Okay, so at that time we get big abscesses all over our body. Nowadays we're not having, you're just having some pimple or something like this. And this was very, very painful. I remember when I was kid, I used to go to my just maternal nanny side and I used to just play every time. So I used to have it. Okay. Next is ARDS, acute respiratory distress syndrome, that we're going to study about tomorrow. Okay. Next, now let's learn about management of pneumonia. So it is infection. So every infection is treated with your antibiotic. Okay. So the first problem infection, the bacterial growth. So you're going to halt the bacterial growth by giving antibiotic. And second is your oxygen, because they decrease in the ventilation perfusion. So you're going to give patient oxygen. Third is your ventilator. Okay. And spirometry you're going to do, postural drainage you're going to do, and your chest physiotherapy you're going to give. You can give bronchodilator depending upon the case to case. Understood? Antibiotic is given
Yes, ma'am.
every time because it
Yes.
is cause due to infection. Understood?
Yes.
Pneumonia,
Yes.
Yes, ma'am.
cause of pneumonia, exactly what happens in pneumonia. Okay, then you can do what are diagnostic? Chest X-ray, right chest X-ray, sputum culture,
CBC, ABGs.
CBC, very good. ABGs you're going to do CBC, sputum culture, blood culture, okay, chest X-ray, bronchoscopy. Okay. Next, learn about sputum culture. How to take sputum culture? Morning fresh sputum culture is taken.
Early in the morning,
30
ma'am.
ml of sputum culture is taken in a sterile bottle. LPN can take, UAP can take sputum. Understood?
Yes.
Yes, ma'am.
Rinse
So,
the mouth, then.
sorry.
Oh, first eliminating
First
the
day, first,
patient,
yes.
rinse the mouth, then stimulate the cough and give the sputum.
Rinse your mouth with normal water on
Yes.
line. Do not take antibiotic.
Breaks.
Before
Yes.
taking antibiotic,
Before.
you need to give
Yes.
sputum.
Yeah. Yes.
Yes.
Before taking antibiotic, you're going to give sputum. Okay. Understood till now?
Yes,
Yes,
ma'am.
ma'am.
Yes.
Okay. Good. This was all about your pneumonia. Okay. Next, I want to talk about your. Okay. Let's talk about something about ARDS that I want to do tomorrow because already there is so much of time. I've already studied.
Yes.
So your
Madam,
homework too?
can we get this pneumonia last two classes notes.
I will give you notes, okay? I will give you notes. Don't worry. If it's not provided, I will give you the notes of pneumonia. Okay. I want to talk
Not
about
only
some.
pneumonia, before two cases,
Yes,
two
yes.
classes.
I
Okay.
think back then I've sent you most of the notes, but now I'm sending you today. I will send you more of the notes. Okay.
Yeah. Okay.
So, okay, this was all for today. Okay. Anyone having any doubt?
Ma'am.
Sorry?
No, ma'am.
No, ma'am. No, ma'am.
Clear, ma'am.
Clear?
Ma'am, I have a question.
Yes.
Is it possible when patient going to be pneumonia type first or a type second, they're going to be the pulmonary effusion in future?
Yes, I told you. Pulmonary effusion is a complication of pneumonia. I have asked you to write
Yes.
this thing.
And septic shock is also
Yes. What do you mean by
when
septic
infection
shock?
going to the bloodstream.
Yes. The bacteria can enter your blood and you can also have septic shock and medical
Yeah.
emergency. So any change in the vital signs is your septic shock, and
Okay, thank you.
distributive shock, and distributive shock is a medical emergency. There is a decrease in the BP, there is increase in temperature, increase in the heart rate. Definition of septic shock: BP less than 90 is your medical emergency in NCLEX.
Yes.
Okay. Let's understand one thing that I want to teach you very, very clearly.